In this video, we are going to teach you how to self-align your sacrum. And this is important because your sacrum is in the area where your core is. It's your pelvis. It's your center of gravity. So having this area more symmetrical is going to help with balance and coordination. Before we teach you how to align it, it's extremely important to kind of understand the basic movement in this region here where the sacrum is. So the sacrum is this triangular shaped bone, and you've got the two halves of your pelvis on each side. The joints are right here. This is the sacrum, this is the pelvis, this is called the sacroiliac joint, or this is the ilium right here. If I look at it this way here, where we turn around looking more from the front, there is that joint. Now the movement in this area is such that it's more of like a rocking. This doesn't show the movement too well, but you can kind of see there's this rocking movement. So as this pelvis goes forward, it just slides on that sacrum. We can use this information to understand that if I take one pelvis forward and the other one back, and then go back and forth, we are going to help mobilize that area to get more symmetry. So here is our first movement or example of what we can do to self-mobilize and align that area. You can be on a step. Now, if you're worried about balance, you can have a wall right here. You could be on a step with a handrail to have that balance there for you. But you're going to stand on one leg, and you're going to drop one leg down, make it longer and then shorter. And what I'm doing is moving that pelvis on that sacrum in these positions right here. So making it long and short. Now, one thing you'll notice that I'm not doing is I'm not bending my knee. This is really important because we don't want to be doing this. That's just a squat. Now you're just staying nice and stable in here. What we're looking for is the movement in here. Now the alignment portion comes in. It's not like your sacrum's really out of alignment and you're putting something back in place. What I mean by alignment is we're going for symmetrical movement side to side. So we would check in with the other side and do that same thing. I'm going to get a little bit closer here, and I'm going to make it long and short. Long and short. Again, notice that my knee is not bending. And now I'm just rocking that sacrum in through there. Another option, anything where you bring your knee deep into your chest on one side. This could be get something up high on a ledge and do these kinds of movements here, especially if you get in a deep knee bend and a deep hip bend where you're flexed like this and you engage that glute. Now you don't necessarily have to step up like this, but sometimes those movements where you really engage the glute in this position can be helpful. Now, something that's easier for a lot of people is to lay on a ground, lay on their back, bring their knee deep into their chest, really stretch that there, and then they would kick into something. Now, when I'm working with my patients with this, I will personally press their knee this way and have them press into me, but you could just use your own resistance here. Some people find straps or bands and kind of strap around a table and do this here. And then, of course, you would check in with both sides here and press. One more option with this here is just any variation of a lunge. Anytime you lunge, I've got the same thing going on. So just practicing deep lunges and finding symmetry in a lunge position can be helpful. If you prefer to sit, we've got another option. In the very back part of our hips here, if there's an imbalance with the muscle forces in through there, sometimes that's going to cause some of that asymmetry. So one final option is to sit, chest upright. We're going to have our ankle on the opposite knee, kind of just stabilize that knee down, be upright, and you're going to come forward with your chest. That's going to get a big stretch in there. Then what you can do is oscillate, where you bring your knee more towards your chest, almost towards your opposite shoulder. Same thing, stay tall. And you would oscillate these movements back and forth. And again, check in with the other side and find the symmetry and the balance, because that is what's going to help give you that alignment. So there are a few movements for self-alignment. Now there are many more. These are just a few. If you think you need a more individualized approach for you, if you have questions, feel free to find our contact information on our profile and let us know. You can also leave a comment below, like the video, and we will talk to you soon.